So thanks for coming. I'm Catalia. I'm on the G&A. Obviously, you've gotten a lot of emails from me, the Master's Entry Chair. But I just thought this would be really nice to have some informal discussion, basically about people that have graduated from programs like the one we're in, either Master's Entry or what we call the traditional Master's program. But what I could do is just introduce everybody, and then you guys can go right ahead and take turns just talking about what you've done in terms of schooling and where you are now.
Just to start, I did the traditional route for my degree, so I was not Master's Entry. I actually worked over at Children's Hospital Boston for 2 years before I decided to go back to school. I always knew I wanted to, but I felt like I wanted a little bit of time between undergrad and grad. So I was in the NICU at Children's Boston, and then when I went to school, I went per diem, so I was also in the pediatric ICU and the cardiac ICU, and sort of rotated between the units, floating around, which was really great experience while I was in school. And then for the program, I started out just taking one class at a time, and then I thought, no, I need to expedite this. So I ended up graduating in 2.5 years, even though I thought maybe I would extend it a little bit longer. And when I got out of school, I had big plans to join some primary care clinic, as I thought I really liked primary care. Unfortunately, Boston does not really have many opportunities for people that are interested in primary care. And it's not that I wasn't interested in a specialty, I just thought, you know, that would be a really great place to start, because in terms of specialties, I found it a little bit overwhelming to think, well, what is my interest? You know, there's so many options, and I didn't want to pigeonhole too soon, because I was worried that if I specialized and didn't like and never had primary care, that I would ended up doing myself a disservice. So that plan didn't work out, and I think one thing I'm going to stress this entire forum is keep an open mind when you go job hunting. I was stuck in a rut thinking I wanted primary care. I had a couple offers that came in over the course of about 2 years, from the time I graduated to the time I finally took a job. But all of the offers were like outside of Boston, would have been a commute, we're only offering you part-time, and I kept like holding out thinking, oh, the next job is going to come around the corner, and then it didn't. Nothing ever ended up being ideal. I think the closest I came to actually taking a position in primary care was for a job in the Cape. That's crazy. I was planning on commuting from Boston to the Cape just because I thought I had to do primary care. Then, out of the blue, a position came up here. It was actually posted for a PA, not a nurse practitioner. And with my background working in ICUs at Children's Hospital, I have a lot of experience with pediatric otolaryngology, because every kid in the ICU ends up seeing an otolaryngologist at some point. A lot of them have airway anomalies, difficult intubations, especially in the NICU. You see a lot of kids with just congenitally complex conditions that require oral. So I was like, well, that's sort of interesting. I'm like, if I have to do a specialty, actually, yeah, I am sort of interested in ENT. That seems neat. So I looked into it more and ended up applying, but I had to do it a non-traditional way, because since it was posted as a PA position, I couldn't just apply online and expect anybody to look at my resume and actually take me seriously. In fact, if I just did that, they'd probably think, who is this nurse practitioner who accidentally applied to a PA position? She clearly didn't read the job post. So instead, I reached out to the woman who was currently in the PA position and actually direct emailed her and said, hey, this is my resume. My name is Sarah. I'm interested in the job. I know it's posted for a PA, but maybe if you're nice, you'll pass along my information to somebody who's, you know, a higher up, and I could get an interview. And that's how it sort of panned out. I kind of went backwards way about it, but ended up landing an interview and ultimately getting a job here. And honestly, the more I heard about the department and the people that I would be working for, the more excited I got, and the more I realized, wow, like, why didn't I think about a specialty earlier? This was silly of me. And I think you'll find in Boston there are so many opportunities for nurse practitioners and specialties that are just fantastic. You can have a lot more autonomy than you may realize, and so it's a pretty good place to start. And I don't feel pigeonholed. I mean, you see so much, like in ENT, I see so much. I see kids from so many backgrounds that if I ever wanted to do something different down the road, I don't feel like I'm going to become so specialized that I can't do that. that being said, I've had a blast in this position since I started. That's what I have no plans for leaving. I think it's just great. And so maybe it surprised me a little bit, but I've actually really grown into this. And I think a lot of it too is the people I work with, Kara being one of them on the adult side, but the surgeons that I work with are so fun and so embracing of the idea of an NP. So it's been great. It's been an opportunity for growth. I'm learning a ton, and I really, really love it. I really, really love it. So, but like I said, it took me 2 years to get here, so I'm still very novice. I just started this position in May, and then after being here 10 weeks, I took maternity leave because I had a baby. So I was literally here for 10 weeks, gone for 3 months, and now I've restarted just a few weeks ago. So out of the 6 months that I've technically been here, I've actually only been in clinic for 3 months. So I'm a very new NP, despite having graduated a while ago.
Welcome. My name is Kara. So I did the master's entry route. I had my undergraduate degree in sociology and psychology with a minor in Spanish, and towards the end of my bachelor's degree, I was kind of floundering on what I wanted to do with the rest of my life, and nursing isn't really something I had ever considered just because my school didn't have a nursing program. And literally with 2 weeks left to go in school, it's kind of like a light bulb went off, and I was like, I think I want to go into nursing. So I went full steam ahead. I applied for nursing assistant certification through the Red Cross, got my nursing assistant certification, and then took a year to do prerequisite courses, and then started at BC the following fall. So I ended up doing the master's entry program. I did both years full-time in the adult health program. And I too, like Sarah, thought primary care was what I wanted to do. At first, when I started looking for jobs, that's specifically all I was looking for, but then I tried to be a little bit more open-minded because I was definitely eager to get working. And I actually lucked out. I got a lot of interviews pretty quickly, some in skilled nursing facilities, a few in primary care offices. But like Sarah said, it's a little bit harder to get primary care within the city, so most of the primary care interviews I was getting were kind of in the suburban areas, and I was living in the city at the time and didn't really want to commute all that much. And this position actually just kind of fell into my lap. It wasn't anything that I had ever really considered, but a nurse practitioner that used to work here, who had also gone to BC and graduated like 15 years ago, had reached out to a few of my professors because they were starting a new role within the ENT department here, specifically working with the head and neck cancer surgeon. So they had just brought on a new head and neck surgeon, and they were looking for an NP to work with the two surgeons as a newly created role. So they wanted somebody who perhaps had background nursing experience, which I didn't have, as well as oncology experience, which I also didn't have. But my professors recommended me anyway, kind of hooked me up with Rachel, who's the nurse practitioner that worked here before. She doesn't work here anymore. But so I contacted the department directly. They brought me in for an interview, and fortunately they really liked me, even though I didn't have exactly the background they were looking for. And I love the two surgeons I interviewed with, everybody else in the department, and I kind of went into the interview like thinking, I don't think this is really going to be for me. I really want to do primary care. I don't want to pigeonhole myself. But once I sat down and talked with them, I realized that it actually sounded like a really exciting opportunity, and ended up taking the job, and I'm so thrilled that I did. I work in a little bit more of a specialized area than Sarah, because she does kind of everything within ENT, and I work specifically with the head and neck cancer patients in ENT, so it's even more of a specialized role. But one of the things I really, really love about it is that those patients really need multidisciplinary care, and one of the great things about being in a hospital is that you're connected to all the different departments. So we work very, very closely with radiation oncology, medical oncology, speech pathology, nutrition, social work. I'm talking to all those people every day, meeting with them, talking to them by phone, emailing. So it's really nice to have all those resources right at your fingertips, and I've learned so much through that as well. Another thing that's been really great about the department and just being in an academic center is that we have residents that work in our department, and I feel like I've learned a lot from them, but I've also gotten to piggyback a little bit on their education. We get to go to a lot of their didactic sessions and hear their PIMP sessions, and I learn a lot through that as well. And it's nice to have people that are your age that are still kind of learning as well. It's just been a really welcoming environment. sometimes I do worry a little bit. I've been here for 3 years now, and I do worry sometimes that I'm losing some of my skills. I'm mostly only doing exams from the neck up, but because I'm working with so many different departments, I feel like it does kind of keep me fresh, and I don't know, now that I think about going back to primary care, I don't think I would necessarily want to do that. I've enjoyed the specialty so much, but we'll see where I go from here. But like Sarah said, I would definitely keep an open mind, definitely explore what's out there, because I was dead set on primary care, and I'm very, very happy where I am now.
I'm Nick. I graduated from Master's Entry in 2010. Before I went to BC, I went to an engineering school for undergrad and majored in biochemistry and biophysics, and I was going to use that to go the medical route. One of my clinical experiences I had when I was an undergrad, I worked on a unit with other, male nurses, and then that kind of popped up as a, potential option for me. And, after school, I took a year off, and I worked in a primary care clinic, and I got a chance to see NPs and PAs and MDs do their thing. And, I think a lot of just that experience kind of pushed me in the direction of, going into the, nursing field and, becoming an NP. And so I started BC, and that was it was a pretty hectic experience. I think a lot of times they weren't super organized, but I think just you kind of make the best of it, and I think like they mean well, and I think I think they're coming along from what I hear. Then as I was transitioning to I was moving to the end of my second year. I started applying to various jobs, as many jobs as I could apply for. My interests were essentially in geriatric primary care. So, I essentially, my job hunt, was focused in that direction. And I did get I almost actually got a job before I graduated with Evercare. That, they're a primary care provider under United Healthcare that serves a lot of geriatrics in the Boston area in long-term care. I came very close to getting a job there, and I was like heartbroken when I didn't get it because it sounded like my ideal job. So I didn't get that, and unfortunately, or fortunately, depending on how you look at it, I took a job as an RN, and for about 4 months I worked really, really tough RN hours. I was working overnight, Friday through Monday, and it was pretty tough. Most of my friends got NP jobs. I wasn't fortunate enough to get. I think going the geriatric route, it's kind of tough for a new grad to get a job there, just because there's really a paucity of geriatricians and geriatric NPs that are willing to take new people on. But fortunately, I made a lot of noise with my professors and preceptors, and one of my professors actually got back to me 4 months in, which was great. And essentially, she told me that there was an opening in the VA in Bedford in essentially a hospice palliative care unit for really old, demented patients. So, that was it was something that I was willing to take. It was in geriatrics. I'd be seeing the very old and people that were afflicted with really advanced stage disease. So that was right up kind of right up my alley, right up right where my interests lied. And I interviewed there, and it was pretty. My first interview was pretty daunting. I entered a conference room with like 4 physicians, 3 social workers, a bunch of nurses, a couple administrators, and they conducted a behavioral interview. And I'm not sure if any of you know what that is. Basically, people ask you questions that refer to past experiences you have that are germane to the job you're interviewing for. So in front of a whole crowd of people, I had to like go over what my biggest weakness was and how I really developed that area, and then they asked me a couple instances. They asked me for an example of like just a scenario where I prescribed a medication. So I kind of went over. I walked them through one of my. It was really intimidating and daunting, but I walked them through one of my patients that I adjusted a blood pressure medication on. I gave them all the relevant stuff, and Then they asked me a COPD exacerbation scenario and how I'd manage it from start to finish, and in front of like a whole crowd of people, and I don't even know how I got through that. And then after that, like it was, I've taken such a hard road to get to where I am, just from all the interviews and kind of not getting close to getting jobs that I want, and not getting them, so it's kind of tough. And then I had I think a 5-hour day where I basically sat down with all the people I'd be working with, and they kind of just got a chance to know who I was and stuff. And I think as long as you like she said, keep an open mind, have a good attitude, like demonstrate that you're interested in whatever job you're interviewing for, and demonstrate that you're a good communicator. That's key. Just work on that. I think a lot of people are willing to take someone new on, just as long as you have those traits. A lot of things you can't kind of teach someone. There's a lot of technical stuff that they'll teach you when you get there. So I don't think there was any way that that they would have hired, at least where I'm working, they would not have hired somebody in their 40s or 50s to work with the NP that's already there, because she's someone that really likes working with younger people. She kind of likes molding people into what she wants, and that's something to remember, that not everyone wants someone that's really experienced. Some people want someone new that they can kind of mold. And so if you can just demonstrate some just really good core characteristics, and just have a good attitude, and I don't know, just be like, just have an infectious personality, I think you can't go wrong with that. And some places they really do want someone experienced, but some places don't. And so don't be too don't get too worked up and worried about it. So I transitioned from my RN job to my NP job, and it was a little bit of a tough transition. The NP that was supposed to show me how to do things, she was out for the first 3 months. She was out for about a month. A couple days a week she was out for various reasons. So and we also had the supervising physician that was there switched to a more administrative role, and they put a physician in there that didn't want to be there, had no interest in doing the job, and didn't really know how to do the job. And then I work with a nursing staff that's very passionate, but they really want things when they ask for it. When they ask for something, if they don't get it within a certain few hours, I mean, they're kind of on the phone with some of the physicians you work with trying to get things. And so, and also, when I started working, there was the danger of the Bedford VA merging with Boston. So I was actually, from the first couple of weeks, I didn't know how long I was going to have that job for. It was a nightmare scenario for the first 3 months. After about 3 months, I felt like I was hitting a wall and I wanted to quit. And I kind of just really did some, really just had to sit down, and I had to, really do some soul searching a little bit, and just, go over what the value would be to quitting. And I decided not to. And I decided to kind of work on some what I thought were weaknesses that I was fortunate enough, and I can't emphasize this enough, to find a mentor, find someone that is kind of either a physician or an NP or a PA, or someone that's in that provider role that can kind of you can confide in, that won't tell other people what issues you're having, that can kind of help you along. If you can find somebody like that, that's so key. And I found that 3 months in, there was a geriatrician that heard about my scenario, and he came to my office one day out of the blue, and he was like, I heard you're interested in geriatrics, and he just sat down, and anytime a problem came up, I'd just give him a call, and we kind of go over it. And so he was kind of a catalyst for my development, because it's tough when you're on your own, and you have to like fend for yourself, and you just don't, you don't know what you don't know what the consequences of your actions are going to be. And so, also we have, like she said, it's nice when you have we have geriatric fellows that pass through, so they kind of know that you just went to school and that you're learning, and they also help me out a lot too. So yeah, just try to find people whenever you work. Just be like friendly, buy them a coffee or something. I don't know, do something like non-awkward, and just try to try to get somebody on your side, because it's tough when you're starting out and you don't know a whole lot. But BC, what they do a great job of, I felt as though they didn't really do a whole lot of like the technical aspects, like how to suture somebody, how to remove sutures, a lot of basic things that you might need in the you might need in whatever clinical setting you're going into. But what they do teach you, I really think they teach you a great do a great job in terms of helping your clinical reasoning, helping you reason through different difficult scenarios. And just by that alone, a lot of times the details you're worrying about aren't details you really need to be concerned with, because they don't really apply as much as you think. If you really think